Real people, real opinions, Real Talk Radio. The multi-award winning Niall Boylan Show.
Ireland's classic hits.
We often talk to parents of children with special needs about the services in this country. And sadly, the story is always the same, really. The services are lacking. We even had Anne Rabbit here in the studio not so long ago talking about improving those services, and I haven't really seen any massive improvement. She promised me that she would be back in 6 weeks to tell us the improvements she made, and that was going back about 4 months ago. Anyway, mind you, maybe we haven't invited her back in. We should invite her back in, but she didn't make an effort to contact us to come back in. Anyway, this week, the Autism Innovation Strategy Report was published, and we wanted to discuss its contents and what it means for families with children with autistic children. And joining me on the line is neurodivergent author and parent of an autistic child, Lhara Mullins, should I say, and she is a lecturer in health and promotion in NUIG in Galway. Good evening to you, Lhara.
Hi, Niall. Delighted to be on. Thanks so much for having me.
Now, first of all, let's explain to people, first of all, I suppose people may not be familiar with the word neurodivergent. And I suppose it kind of refers to, the human brain and the cognition and instances of sociability and learning, attention, mood swings. It kind of describes an inability to be this or to take information in the same as other people, I suppose. Would that be correct?
Exactly. So neurodivergent is an umbrella term, and this covers autism, ADHD, dyspraxia, dyslexia, and dyscalculia. Now, there may have been something added to that since I last checked, but it really just means somebody whose brain works differently. So, like when we talk about autism, some people still label it in the medical field autistic spectrum disorder, but neurodiversity is taking it from an approach. It's not a disorder, it's a difference. So we're looking at it differently, we're viewing it differently, and we're responding to it differently.
Do we look at autism and, all the different complications of autism under that umbrella in the wrong way? Because I always think back to when I was young and in school, and there was lads in school who were a little bit slower than others. There were some that were a little bit different to others. There were some who were a little bit more hyper than others. And we didn't label people at the time, and maybe we should have, because they would have got the right help they needed to get their education better. But there is this idea that there's some sort of level of normality in society. I think, because we see all the time children under the spectrum of autism are so gifted in other ways. And we've seen that with CEOs of very large companies, who are on the spectrum. And maybe we look at it the wrong way. Do we look at it the wrong way?
I don't know. I think we need the typical or the average in order to measure difficulties that somebody has and to be able to put support in place. And like autism is so broad, so one of my children would be, very well able to mask in public. It would absolutely exhaust her, but you wouldn't pick her out of a crowd. Another one of my children, you'd immediately know that this child had additional needs. Whereas some of the other families that I'm in contact with were a great community, parents of autistic children. Would have children who are pre-verbal or non-verbal, so they're not communicating verbally at all. And then most autistic children then have another comorbidity. So some will have intellectual disability, some will have dyslexia, dyspraxia, or ADHD as well. So these are more likely. So 70% of autistic kids also have another diagnosed disability too. So I do think that the differentiation is important so that we can create the supportive environments. So what a lot of autistic adults are saying now is that they were really damaged as children because the supports weren't put in place. So they were socially excluded.
They were stigmatized.
Yeah.
Well, as I mentioned to you already, in school, if you were, as we called it in those days, a slow learner, you were put into room 4 with the children who were, remedial was the word we used to use in those days. I'm sure you remember that word, remedial. So you were put into that and you were forgotten about. That was it. You were difficult to teach.
But that would stay with you forever. And my experience with exclusion first time round with my eldest daughter was the whole birthday party thing. This was just, it was emotional torture as a parent to see your child not invited to parties again and again and again. And we even had one instant, we walked into a party accidentally in a play area that was going on. And it was just, were the moments, I can still feel it now when I think about it, but that's the reality for a lot of our children. Now, some children don't notice, which is almost a blessing in disguise. They don't notice that they're excluded, that they're not.
And did your son notice? Did he notice?
My daughter didn't.
Oh, sorry, daughter. Sorry, I do apologise.
No, she didn't, which is she was about 6 at the time. She didn't notice, and I was obviously a state. I was so upset.
She noticed you. She noticed you being upset more so than she noticed
me being upset, but she didn't get the context of what had happened.
Yeah.
And then after that, there was another time. There was an invitation in her bag, and we went looking for it, and there actually wasn't one. So she thought there was, stuff like that,
God.
where but your heart would break.
Oh,
it
would break your heart. That kind of stuff really, really would upset you, and I know how you feel. I mean, it's very, very difficult when you're in that situation. But this report. This is the Autism Innovation Strategy Report. Firstly, who sanctioned the report and what was in the report and what does it say? Because we clearly hear all the time, because we've talked about it many times on the daytime show as well, we talked about the fact that so many parents in this country are waiting patiently for, a year to 3 years after they've got a diagnosis to get some sort of treatment. And meanwhile, the child is just getting worse and worse.
Yes, so Minister Anne Rabbitte launched this report this week, and I was actually really impressed with the report. And I have to commend Minister Rabbitte as well. She's asked the difficult questions, and she's trying to get things moving on this. So it's really promising in terms of it's really based largely on the thoughts, views, and ideas from autistic adults. And this is what we need to be doing: is getting people with the lived experience to be using their voices. The voices of autistic people are really important. So they talk about streamlining assessment. So this would be one thing I'd be really passionate about. So at the moment, you have to knock on all the doors now. You might knock on CAM's door, and if there's a diagnosis of autism, they won't see your child, even if your child is having a serious mental health issue at that time. You'll knock on the door of the assessment of need, and they'll say, oh, you don't qualify for this. You haven't got an OT assessment. So you're pushed from pillar to post. So they've recommended within the Autism Innovation Strategy that we streamline how to go about getting an assessment. So people ask me this all the time: how do you get your child assessed? And I still can't answer that question.
Well, I suppose the argument is if you've got money, you can get it done quicker too, because you can go privately, but not everybody can afford to do that.
Absolutely. And then the flip side of that is if you go privately, oftentimes the public system then won't accept that diagnosis and won't give your child therapies based on that. You still have to do the wait. So it's kind of, 6 of one and half a dozen of the other, and then the cost of it. So a lot of parents, particularly with children who are profoundly autistic or with intellectual disability as well, they're relying on carers allowance. They're not able to work because they're looking after their children 24/7. They absolutely can't afford 12 or 1,400 euros for a private assessment. Mm-hmm. It's just not possible.
And also you mentioned as well that a lot of parents of autistic or children with ADHD are neurodivergent themselves, possibly, and they can't access or afford the assessments too. So, I mean, yes, I don't know what the evidence is in relation to, and maybe you could tell me, you might know better than I do, but children who do have ADHD or do have autism or do have anything under the spectrum, I mean, have they ever proven that there's some sort of genetic reason for it? Is there a genetic reason for it?
Yes, so we do know now that there's a genetic component to it. So when my first of my 3 autistic children was diagnosed initially with ADHD, I did kind of think, you know what, now, if this was me now, I would totally be diagnosed with this. But obviously there was no such thing as ADHD, or we didn't understand it as much back when I was in school. But it was only, 15 years later that I was in a position to actually pursue a diagnosis for myself. But since then, I've been doing polls and I've been speaking to people on Twitter because I'm fascinated by this. I wonder how many of us are in this cohort that kind of missed the mark. So it turns out that I would say my estimation would be that more than half either suspect that they are or have since got a diagnosis of autism or ADHD themselves. But a lot of parents like that, there is no public autism diagnosis at all for adults in Ireland at the moment. We are starting to see developments for public ADHD assessment and diagnosis. Again, it's a 1.5 to 2 year wait, but that's something. But there isn't one for autism. So if you're navigating these systems and you are either living with autism undiagnosed yourself or you're living with ADHD undiagnosed, it's creating additional barriers, to be going in and be navigating these services. You'd nearly need a PhD just to be able to work the system that, that it's advantageous to your child, never mind yourself.
And I suppose they're losing out on education because while you're waiting to get your assessment, waiting to get your treatment, waiting to get any kind of treatments that you might need, like occupational therapy or whatever it is that you might need, or special education, an SNA or whatever it is that you need, your child is regressing. And you mentioned as well some children have been left for six months sitting in their bedroom, or a child has a reduced timetable in school or labelled bold by the school because the school are not in a position to be able to deal with the child's issues. That's very difficult because the child loses out in education, which can affect long term the child's life, of course.
Absolutely, but I think a child remembering that other children viewed them and, labels them and call them sometimes directly the bold child. It's usually other children and it's not the school, but without a diagnosis, children can be put into that box. And without even an assessment, school aren't always going to be able to meet their child's needs because they don't know what those needs are specifically. And so a child that's, suffering from extreme anxiety or distress because of how something feels or noise in the room, they're not going to be able to use their words to say that if they're autistic. They're likely going to maybe, lash out, kick a chair, refuse to sit down. This is how they're communicating. I'm not coping with this. I'm really distressed. But they could be 2 years expressing this distress in the classroom before they're able to get an assessment and a diagnosis. And then it could be another 2 to 3 years before they get any services or treatment.
When we talk about treating the children, have we ever or do we do a good job at treating the parents? And when I say treating the parents, I know there's so many parents all over the country with children with ADHD or autism or dyspraxia or whatever it happens to be. And the child is lashing out every now and again, mood swings, all the usual stuff that people are used to when they have a child with those symptoms, that diagnosis. I mean, what about, talking to parents and training and teaching parents to deal with their own child, that they're able to deal with it in the best possible way to give that child a better chance? And that kind of gets to the root of the problem then, does it? Because a lot of the time the parent has no understanding of how to deal with it because it's so difficult and can be extremely difficult. And that in turn doesn't do the child any good. So are we focusing on that as well and helping parents to deal with it?
Yeah, so there's no precedent really. So when you initially maybe notice communication difficulties or like challenging behaviour, that's a really good example that you gave, Niall, because that's very distressing for the whole family when a child is lashing out or having, violent or aggressive episodes very regularly. There is no precedent, so you can't ask your friend Mary down the road how she coped with this because she likely didn't ever experience it. So you're very much on your own, and that socially isolates families because if your child is lashing out and hurting other children or hurting you or themselves, you can't just go to the park with them or go to a play centre. It doesn't work like that. Parents are being offered parenting courses. Now, this is kind of an irk for me, I won't lie. I think that parenting courses, so I did one years ago, I'm speaking from experience, parenting courses, I haven't heard of one that's specifically tailored to autistic children and responding to an autistic child or a child with ADHD the same as you would a neurotypical child doesn't work. So you need to change the environment and not the child's behaviour. If we change the environment, the child's behaviour will change. But I think also that by the time parents get to services, they're so exhausted, they're so desperate for support for their children that when the suggestion of a parenting course comes, particularly if this happens prior to their children being offered any therapies, for me, it just makes me turn red. It really does.
But there'll never be a perfect system for this because, sorry for interrupting, but because I don't think money is ever the issue. Because look, the government has, a massive amount of money this year. They've an extra 10 billion in the budget, right? Money is probably not the issue here. The issue is trying to get trained people. We don't have enough young people, say, for example, going into courses for psychotherapy, for child psychologists, whatever it is. So we don't have enough people who are trained to deal with these issues. And the ones that are dealing with it, in my view, are not doing it efficiently enough.
Well, I must say now, individually, for any therapist I've met with my children, we haven't had a whole lot of bad experiences. I think that the goals are as they should be and that they really want to help. But when you're a half a team and you have twice the workload that you should have, that's going to impact every single avenue of service provision. So there just isn't enough of them. I heard today about the incentive for teachers in Western Australia, and they're giving them a $10,000, €10,000. And I'm like, wow, we could do that for Children with Disability Network teams. This would make such a difference.
We should. I don't understand. I mean, I heard that on the news earlier on myself tonight there at 10 o'clock, right? And I was saying, if I was a teacher sitting at home and heard that, I'd be thinking, I'd be packing my cases going to Sydney. Absolutely. So why wouldn't you? So there's no.
I considered it myself. today now, I have to say I did.
There's no incentive for qualified people or people who want to be qualified to help children or to help, people who are ill or to be carers or whatever it happens. There's no incentive to stay here, is there?
No, and particularly if you're on that team that's a half a team and you're completely stressed and the parents
bogged
that are
down,
really
yes,
stressed
of
are
course,
making contact with you, it's going to be a cycle of being in a really stressful environment, and nobody wants to go to work if that's the environment they're working in. But I'd love to know who has the power with those purse strings to say, well, actually, yes, we are going to say, relocation. If people are relocating from, we'll say, Dublin to Roscommon, we're going to give them a relocation budget, or we're going to have incentives whereby. But then you'd also have to consider the existing staff that are staying there. There should be incentives for them to stay as well. We need to be working on retention strategies and recruitment strategies.
And has CAMS got any better? Because the last time we discussed CAMS on the air, I had a stream of calls on the air from parents who had signed up with CAMS, to try and get treatment for their child with dyspraxia, dyslexia, ADHD or whatever, autism, whatever part or section of the umbrella it was. And they couldn't get an appointment. They were waiting. One got an appointment. It took like nearly 3 years. You know what I mean? So has that improved at all?
Well, to be honest now, my own experience isn't with CAMS, but I actually we have a really good community group on Facebook, so I actually spoke to my peers and the other moms this evening before I spoke to you to ask, are there any other issues that I need to be advocating for? Because I'm really conscious that I'm at kind of the experienced part of my journey now, and that's why I wrote my book, because I had done the really, really hard days. But there's lots of other parents at the start of their journey now that are struggling. And one of my support moms actually told me that, so at the moment now in Athlone, there's 3 families of autistic children who need CAMS support, and CAMS are not accepting these families right now because they have a diagnosis of autism. So this is what happens. So they'll actually be refused services because they have that diagnosis. Now, I've heard of this in the Disability Support Service before. If somebody has an intellectual disability, X organisation won't take them. Or if somebody has dyspraxia, they won't take them. So it's any excuse to get people off the list. And again, this isn't an individual therapist's decision. This is a whole organisation. We're overwhelmed and we need to get them onto somebody else's books. But really, these are children who still don't have services. And if a child is being referred to CAMS, then there's a mental health issue. So that's what CAMS focus on, specifically mental health issues. But an autistic child can absolutely have a mental health issue.
Absolutely. But particularly if they're not getting the treatment that they need and the help they need, of course, they're going to end up with a mental health issue.
Oh, that's the other thing. What's the long-term impact of this now? So I have one child who's had 4 years with no services. No, and he went from 11 to 15. He's 15 now. He did his first appointment last week.
And I'm sure COVID was a disaster, by the way, I imagine.
Well, he was on a waiting list for that, but what's really interesting is some families really struggled during COVID, and some families actually had a much easier time because their children weren't put under the pressures, the structure of school and interacting with other people and stuff like that. So it's very mixed bag of experiences. But our children lost out on 2 years of services, but they also lost out on 2 years of experiences of interacting with people. And for children who are autistic and have difficulty with interacting, this is going to have a long-term impact on them.
Well, apart from anything else, going without a service and intervention for 2 or 3 years can cause them to regress as well, apart from anything else. So things get worse then instead of better. With your own children, by the way, I suppose there are a lot of young families out there and maybe they've noticed some of those milestones are not being reached by their child as they expect. And by the way, I don't want to panic parents. Some children reach milestones at different rates. They might learn to walk and talk and hear and, understand things at different rates at different ages. But in saying that, it must be very difficult, and it must have been very difficult for you at the start, recognising that there was a difficulty and a special need within your child.
And it's interesting because when we're at home here, and because we're such a neurodivergent house now, so not typical is our typical, and when you're with your child on your own and you don't see them with your peers, it's difficult to pick up that something might be different or not typical, or that they might need additional support. But I can really see it when I see my children now with their peers. You can really notice that difference. And if you have friends or family members who have babies or children of the same age, that's really hard. So that's when you're seeing, that's a little bit different. But you can be suspecting for quite a while, and you can even be maybe broaching the subject with your GP for quite a while. It can take a while for things to become, I suppose, more apparent to the point where they need assessment. But by the time it gets to that point, you might actually even be reaching crisis point, but you still have your 2-year wait.
I'm going to ask a
two-year
question, put you on a spot here before we finish up. If you were in charge and you were Anne Rabbit, and Anne Rabbit could go knocking on Leo Varadkar's door tomorrow for a budget if she wants to, and I'm sure she has, but I'm not suggesting she hasn't made that effort to do that and to increase the budgets to help children with special needs. But if you were in a position of power, and you were allowed to do, say, 3 things to make things better for children with special needs in Ireland, what would you do?
Oh, absolutely no pressure, Niall, with that question. That's absolutely easy. So I would, first of all, fill all of the Children Disability Network teams. I would have a one-stop shop where a referral happens, and within 3 months, like in Germany and other countries where they're doing it properly, within 3 months a child has an assessment. If they're not autistic, absolutely great. They can get other support, go to other services. If they are, they have their whole full team there. So money has to be paid. We need to keep these therapists in place. So that would be where I put a big chunk of money. Also then the schools. So the schools are absolutely fantastic. Now, there is a problem with school places, and there's also a problem with July provision. And when children are in schools, for the most part, the school staff we have are exceptional here. So I'd reinforce that with further funding for SNAs, for resource teachers, and for autism classrooms within mainstream schools. Because obviously, if you have siblings, you want your children to be going to the same school. You don't want to be going to 2 or 3 different schools with your different children. And then thirdly, I'd probably pump the last chunk of money I had into our GP services. So our GPs have been absolutely carrying families of autistic children while they've been on these waiting lists. And me in particular, I'm eternally grateful to our GP practice, and I don't know what I would have done without them. And that's for the emotional support and mental health support for parents as well, who are really struggling with their children and their diagnoses. So we'd be lost without them. So I think GPs need more resources too.
Well, look, I have to say it's been intriguing listening to you, and I think you're a great advocate for what we should be doing, and you are 100% right. There's actually nothing you said tonight that I could disagree with, because I know a lot of parents listening are in a difficult situation with their children, trying to get help for them, and they're crying out for help. They're determined to help their children, and they want to help their children. But sadly, the resources are not there for them, and we need to do better. It's something we really, really need to do better. And you are right, they do it better in other countries. I don't know why we can't do it. But look, what's the name of the book, by the way?
It's called It Takes a Village, Navigating the Journey of Parenting Your Autistic Child.
It takes a village. It's a great line, isn't it, by the way? It does take a village to raise a child, doesn't it? Absolutely. Well, look, it's been lovely talking to you. Thank you indeed, Lhara Mullins. Thanks for coming on the air tonight, and I really appreciate it. And I'm sure it's something we will be talking about again. And reminds me now, actually, to get back to Anne Rabbit, because she did say she'd come back on and tell us how she did, and maybe this would be the ideal time after the report has come out anyway. Thank you very much indeed, Lhara.
I'll remind you. Thanks.
All right. Thanks, Lhara. Bye. Bye. There you go. Absolutely wonderful to listen to a parent who has a great understanding of what it's like to have children with special needs and what we should be doing to help those children. There are so many parents out there listening tonight with children with special needs, with ADHD, with autism, different diagnoses under the spectrum. Some can be more difficult than others. Some can be very mild. Some can be quite to the extreme. And it can be very, very difficult. And my hat is off to all those parents, to be in that situation and to be able to raise a child and do the best they possibly can in a circumstances in a country where we don't have enough help. We just don't. Thank you, Lhara.
Real people, real opinions, Real Talk Radio, the multi-award winning Niall Boylan Show.